Hello guys, welcome to my YouTube channel Legend Pharmacy. Today let's discuss about the very important questions of your first year diploma in pharmacy, old syllabus students. That is pharmaceutical chemistry. Pharmaceutical chemistry important questions with answers you will get here. Okay, and what you have to write what strategy you have to maintain to get very good marks in your examination. Definitely you will pass your video. Just not only you will pass, you will get more than first class. Okay, you are nearer to the distinction. I may not tell that you will definitely get the distinction, but definitely you will nearer to the distinction. Okay, some students they may acquire the distinction also there. Yeah, now let's start the first question in pharmaceutical chemistry. That is here, this one, pharmaceutical chemistry 1, old syllabus students. Write a note on acidifying agent. Very important question. See, acidifying agent. Remember one point. Sometime what they will do means they will ask write a note on acidifying agent. Now in this means acidifying agent, in this some content is there. Like some of the acidifying agent is HCl, dilute hydrochloric acid. It is also acidifying agent. Oh, okay. Now what they will do? Sometimes they will ask write a note on dilute HCl. At that time you have to write same this one only. Okay. Now let's study products for altering gastric pH. Okay, first one is acidifying agent, antacids. Here now let's discuss about only acidifying agent. See, agents used to increase the stomach pH, it is known as acidifying agent. If the stomach pH alters, okay, then we are giving some of the external acidifying agent. Ammonium chloride, calcium chloride, dilute HCl can be used to treat the achlorohydria. Achlorohydria means it is the condition where there is a less secretion of hydrochloric acid. Okay. Achlorohydria is the absence of hydrochloric acid in the gastric secretion. Now patients with this condition fall into two categories. Okay, one is those who remain free of gastric HCl after stimulation with histamine phosphate. Okay, means those who remain free of gastric HCl means those who doesn't have enough amount of HCl after stimulation with histamine. Means if the histamine cells they stimulate the HCl also, the HCl is not coming out. At that time we are using this achlorohydria. Okay, like patients with a subtotal gastrectomy, then atropine gastritis, carcinoma of the stomach or the stomach polyps. Those who normally lack gastric HCl but respond to stimulation by the histamine, like patients with chronic nephritis, chronic alcoholism, tuberculosis, hyperthyroidism, pellagra. Means you understand one thing. One is that gastric is not secreted from the cell. One is that already the gastric is present in the cell but it is not secreted. Two conditions. One condition is gastric acid is there, no HCl. It is not secreted from the histamine cells because in histamine cells there is no power to secrete the HCl. Now second condition, yes, there is a presence of gastric but they are unable to secrete. That is a two conditions. Remember only this one. Okay, this HCl mainly it provides to treat the less acidic content in the stomach. You write this one, it's enough. Functions of HCl: kills the bacteria in indigested food and drink, softens fibrous food, promotes the formation of pepsin that helps in digestion. You know that pepsin helps in digestion. They help for the formation of the pepsin. Thus, lack of HCl can cause gastrointestinal disturbance. Pepsin, HCl is the precursor for this pepsin. Okay, promotes the formation of the pepsin. Symptoms of achlorohydria: mild diarrhea. Okay, then epigastritis, sensitivity to spicy foods. Treatment: dilute HCl we are giving up to 5 ml of dose. Then added to that is 200 ml of water. Provides about 15 of acid. Just to remember, 5 ml of dilute HCl should be dissolved in 200 ml of water. Then we have to take it. Okay, it is a treatment. Next one is write a note on electrolyte replacement therapy. Now what is this electrolyte replacement therapy? You know that replacement, what you are replacing electrolyte. Why means because of any reason, you take the main reason for the electrolyte loss is the dehydration that's caused by the diarrhea. Okay, your electrolytes get washed out. So to replace that we are using this therapy. Like how you use the ORSL therapy, no? Same way. Here it is needed for every severe loss of electrolytes and water due to severe vomiting, high fever, wounds due to burns and diarrhea. A solution for rapid initial replacement. A solution for subsequent replacement. Okay, the concentration of electrolyte in quick initial replacement. Solution is more or less similar to that of the extracellular fluid. Some solutions contain a large amount of potassium. It's simple, you have to replace the chemicals, you have to replace the electrolytes. Now for an example, due to diarrhea, sodium electrolytes get out, means they washed, they removed from the body due to diarrhea or dehydration. Now you have to replace that with electrolytes. First one is electrolytes used for the replacement therapy, sodium chloride. You know that NS will be available in the market, normal saline. That normal saline contains 0.9% weight by volume of the sodium chloride. Check it down, you go and check it, or search in the Google and search it down. You will get that. Sodium chloride occurs as a colorless cubic crystals or as a white crystalline powder having a saline taste. You know that salt what we are calling that is, and it is freely soluble in water, more soluble in boiling water, and soluble in glycerin and slightly soluble in alcohol. It is the salt of extracellular fluid. Uses its help for the replacement therapy, manufacture of the isotonic solution, and also flavor enhancer. In order to be isotonic, a salt should be 0.9%. Okay, that's only we are using 0.9% weight by volume of the NS, normal saline. Then available forms of sodium chloride. See, sodium chloride 0.9% sodium chloride, fluid and electrode replenisher, bacteriostatic sodium chloride injections are available, solutions are available, tablets are available, dextrose and sodium chloride, DNS what you are calling, no, that sodium chloride and dextrose tablets are available, mannitol and sodium chloride injections. These are the available form of the sodium chloride. Then potassium chloride, it is one more electrolyte. Here occurs as colorless, elongated, prismatic or the cubic crystals, white granule powders. It is odorless, has a saline taste, stable in air. It is freely soluble in water, more soluble in boiling water, insoluble in alcohol. Then neutral to litmus paper. Then it is a drug of choice for the oral replacement of the potassium. Oral replacement we can give. It is a drug of choice to replace through orally potassium. It is irritating to the gastrointestinal tract, and solution must be well diluted and the tablets must be enteric coated. Potassium chloride is given along as an isotonic solution. In an isotonically balanced solution, sodium chloride or a 500 ml of 5% glucose dextrose solution containing 40 MEq of potassium. Simple, you have to mix with the either sodium chloride or you have to mix with the glucose, that is dextrose. Then use and storage condition for hydrogen peroxide. So you know that hydrogen peroxide, it is antimicrobial agent or antiseptic. Okay, then KMNO4, potassium permanganate, boric acid. From these three, one is definitely they will ask. First one is hydrogen peroxide physical properties. It is pure state, is an almost colorless, okay, very pale blue liquid. Hydrogen peroxide is miscible with water in all proportion and forms a hydrate of H2O to H2O. Then uses of hydrogen peroxide for bleaching silk, wool, hair and leather. As a rocket fuel, hydrogen peroxide is used as a rocket fuel. Then dilute solution in solid perihydrol, or it is used in the synthesis of the hydroquinone, tartaric acid and certain foods and pharmaceuticals like cephalosporins. Okay, it is an antibiotic. To prepare that we are using this hydrogen peroxide. One more, to clean the wound also we are using this. Storage, H2O2 decomposes slowly on exposure to light. So H2O2 is stored in bottles lined with the wax because the rough glass surface causes the decomposition of the hydrogen peroxide. So we have to use which type of the glass? We have to use wax type of the glass. Not glass, wax type of the plastic coating we have to use. Okay, or fiber coating. You know that H2O2 hydrogen peroxide available in the pharmacy, no? Yes, inside that it's coated by one layer is coated with a plastic type, waxy layer. Yeah. This is the hydrogen peroxide. Remember one thing, storage, if you don't know anything, means you write store in a well closed container. Okay, this is a fix. If you know uses, storage means you can write, you can get here for if they ask for 4 marks, means definitely you will get 2 marks. Okay, now for an example, hydrogen peroxide, you know uses, it is used as a disinfectant, it is used to clean the wound. Now storage, store in a clean well closed container. Finish, you will get 2 marks. Now just you have to write physical properties. Physical properties also see very same. Very similar thesis. Soluble in water, soluble in boiling water, it insoluble in alcohol. Simple. Yeah. Next one is potassium permanganate. So property is potassium permanganate, dark purple colored, monoclinic prism, almost opaque, having a blue metallic luster. It is odorless, soluble in water and boiling water, having sweetest means sweet in taste, astringent taste. On heating, it decrypts and decomposes at a high temperature, powerful oxidizing agent. Okay, there is no compulsory to write all the points. Which point you are feeling good means you can easy to remember, that point you can write here. Are you getting what I am telling? Yes. Next one is storage. Keep in tightly closed container, must be handled with care because an explosion in contact with the oxidizable substances. Use an antiseptic in mouthwash, cleaning of ulcers and abscesses. Use the treatment of urethritis and used as an antidote in case of poisoning by barbiturates. Okay, chloral hydrate, and many alkaloids. This is the potassium permanganate. Boric acid properties: colorless, odorless, six-sided triclinic crystals. Then white odorless powder, stable in air, density is 1.46 gram, weak acid. Pharmaceutical uses: it acts as a local anti-infective used in dusting powder, then local antiseptic creams, ointments, lotion. It is aqueous solution used as a mouthwash, eye lotion, skin solutions or skin lotions, not used internally or applied on ruptured skin. Okay, this is the auxiliary level. And last one, storage: preserved in a well closed container. Then define limit test, impurity, assay and astringent. These four you have to define now. First one, what is that? Limit test. See, the quantitative or semi-quantitative test designed to identify and control a small quantity of impurity which is likely to be present in the substance. Limit means limiting the content. Test, we are checking whether the prepared test solution is in limit or not. That's only limit test here. Purpose means to determine the inorganic impurities present in the compounds. Next, our definition is impurities. The pharmaceutical impurities in pharmaceuticals are unwanted chemicals or unwanted substances that even in small amount may influence the efficacy and safety of the pharmaceutical products. Next, assay, to know the amount or the quantity of a given substance in a sample. Okay, simple. What quantity, amount, quantity, not quality, quantity, how much amount of drug is present, which drug? Test drug. That only we are defining, that is assay. Then identification, to characterize and identify the substances. Okay, that is the assay. Then definition of astringent. Astringent is a drug that reacts chemically with cellular proteins, producing limited coagulation which is accompanied with the shrinkage of the body tissues. Very simple. Astringent, what it is? It is a drug actually that reacts with the chemically, it reacts with the cellular proteins. Cellular proteins means cellular proteins of the antimicrobial, proteins of the bacteria. You will act with them and they will shrink the body tissues. Okay, astringent protects from external irritation and also reduce the cellular permeability. It also possesses local septic and local anesthetic action. Mainly astringent, what it is? It is an antimicrobial agent. Simple. What it will do? It will chemically acts on the cellular proteins. Okay, and also it will shrink the body tissue. Shrink is very important point. Give reasons why lead acetate cotton plug is used in arsenic limit test. Very simple. Cotton plug dip in lead acetate solution is used to trap any hydrogen sulfide gas liberated with arsine gas. In arsenic limit test, arsine gas can be liberated. Means can be, no, definitely it will liberate if you don't use this lead acetate cotton. Okay, wool cotton dipped in lead acetate, what it will do? It trap this hydrogen sulfide gas. Okay, hydrogen sulfide gas liberated with arsine gas. Hydrogen sulfide gas, it will trap. Which one? Hydrogen sulfide gas. Arsine gas, it's liberating, but our hydrogen sulfide gas, it should be remain there only. So for that reason we are using this lead acetate cotton. Principle and reaction involved in the sulphate limit test. Very simple. See, first principle, The reaction between the barium chloride and the soluble sulfates in the presence of a dilute HCl. See, here what happened? Barium chloride. Okay, sulfate litmus test. Barium chloride and soluble sulfates. This reaction you understand here. Same if you explain this reaction, means when sulfate made to react with the barium chloride, then there is a formation of the barium sulfate. If you write this one, means this is only the principle. Then you down write the reaction. Clear? Are you getting? Yeah. The barium chloride test solution in the Indian pharmacopoeia has been replaced by the barium sulfate reagent. It is having barium chloride, sulfate free alcohol and a solution of potassium sulfate. Potassium sulfate, okay, that is a KSO4, has added to increase the sensitivity of the test. The ionic concentration in the reagent has been so adjusted that the solubility product of the barium sulfate gets exceed, and the very small amount of sulfate is present in the reagent act as a seeding agent for precipitation of barium sulfate. If sulfate is present in the substance under test, alcohol helps to prevent the supersaturation. The substance passes the limit test if it produces turbidity less than the standard. See, remember one thing, when the limit test passes, if the test is less that on the standard, means turbidity in the test solution should be less. No need to remember these all, just to remember when sulfate made to react with barium chloride, then there is a formation of barium sulfate. That barium sulfate shows the turbid in nature. At last you write the test solution passes when it contains the less amount of the precipitation as compared to the standard. This is the principle, you write this reaction. Next, limit test for chloride. Simple, based on the reaction between the silver nitrate and the soluble chlorides to obtain the silver chloride, which is insoluble in dilute nitric acid. See, the silver chloride produced in the presence of a dilute nitric acid and makes the test solution turbid. The extent of turbidity depending on the amount of chloride present in the substances is compared with the standard opalescence produced by the addition of silver nitrate to the standard solution having a known amount of chloride and the same volume of dilute nitric acid as used in the test solution. Simple, our turbidity mainly depends on the chloride. If chloride is more, means turbidity is more. If turbidity from the sample has been less than the standard turbidity, then the sample passes the limit test. Are you getting what I am telling? Yeah. Then limit test for iron. See, very simple. Based on the reaction of the iron in the solution with thioglycolic acid in the presence of citric acid. Simple, iron solution in the presence of a thioglycolic acid. This is the formation of the product. Okay, here we are using citric acid. Yeah. A formation of the pale pink to deep reddish purple color due to the formation of the ferrous thioglycolate. This is a ferrous thioglycolate, indicating the specified amount of substances from the test is compared by viewing vertically with the standard. Okay, you remember only this much. When iron made to react with the thioglycolic acid in the presence of citric acid, there is a formation of the complex. That complex is a ferric ammonium sulfate. Okay, then ferrous thioglycolate is a colorless in acid or neutral solution. In acidic media in acidic it is colorless in nature. Okay, then you can easily identify where there is a purple color more. If the standard having more purple color than the test, then your limit test passes. That only they are telling here. Citric acid does not allow the precipitate of iron by ammonia by forming a complex with it. The color due to the ferrous compound gets destroyed by oxidizing in alkalis. The thioglycolic acid reduces iron 3 to iron 2. Thioglycolic acid is an analog of glycolic acid which is prepared by the action of potassium hydrogen sulfide on the monochloroacetic acid. It is colorless liquid having unpleasant odor. Okay, this test is very sensitive. Interference of other metal cations is eliminated by using 20% citric acid, which forms a complex with the other metal ions. Method of preparation of standard and test. See, first let's discuss about the standard. If you know the standard means automatically we can write the, if you know the test means automatically we can write the standard, or if you know the standard means automatically we can write the test. From these two, any one you have to remember. See, specified weight of the substances, that substances in which iron is present, that we are taking. To that we are adding 40 ml of water. Then transfer to Nestler cylinder A 2 ml of 20% solution of iron free citric acid and 0.1 ml thioglycolic acid. Make alkaline with iron free ammonia solution. Add that one or 2 drop or 2 ml. Volume make up to 50 ml with water, stir with glass rod and keep aside for 5 minutes. Same, next one standard also say, in spite of test you have to use your standard solution. 2 ml of standard iron solution plus 40 ml of water. Okay, the next steps are all same. 20% 2 ml of iron free citric acid, 0.1 ml thioglycolic acid, make alkaline with free ammonia, then volume up to 50 ml. As I keep aside for 5 minutes, then observe. If the turbidity or if the color, the purple color is more on the standard than the test, then the test passes. This is a conclusion. Limit test for heavy metals. Simple here. The quantity is stated as the heavy metal and is expressed as the parts per lead per million parts of the test substance. The limit test for heavy metals have been based upon the reaction of the metal ion with hydrogen sulfide under the prescribed condition of the test causing the formation of the metal sulfide. Simple. Metal sulfide we are getting the product. Okay, the metallic impurities in substance are expressed as parts of lead per million, that is parts of the substance. Usually limit test IP has been 20 parts per million. And actually we are using 3 methods, method 1, method 2 and method 3. 3 methods are there for the limit test of heavy metals. Now here let's discuss about the method 1, that is known as for clear colorless solution. See, preparation of test solution, 25 ml of the solution which is prepared as per the procedure given under respective monograph from Indian Pharmacopoeia. Okay, 25 ml we prepared. Then adjust the pH between 3 to 4 by adding acetic acid or dilute ammonia solution, 1 ml of solution of potassium cyanide. Just we have to maintain the solution. We have to maintain the solution acidic in nature, that is 3 to 4 by adding the ammonia and the dilute acetic acid, so potassium cyanide. Then we have to dilute with water to about 35 ml mix, means we have to add 35 ml of water to it. Then 10 ml of freshly prepared hydrogen sulfide solution. Then mix well, then dilute water up to 50 ml, allow to stand for 5 minutes. Simple. In Nestler cylinder only we have to perform this test, 50 ml Nestler cylinder. Then preparation of a standard solution, 2 ml of standard lead solution, then dilute it with the water top residue up to 25 ml. Then adjust pH same 3 to 4 by adding dilute acetic acid or dilute ammonia solution, then 1 ml of solution of potassium cyanide, then mix with water up to 35 ml, then add you 10 ml of freshly prepared hydrogen sulfide solution, then take the volume up to 50 ml by adding water. Okay, then you observe. Simple. Where the turbidity is greater, that is the standard. If the turbidity is less, means that is test. Limit test for arsenic. Here for arsenic limit test, this Gutzet apparatus is very important. You have to follow this Gutzet apparatus. Then limit test for arsenic apparatus, it is having a wide mouth bottle of 120 ml, capacity having about 2.5 centimeter in diameter. The bottle is fitted with the rubber bung through which glass tube passes. The glass tube is 2 cm long, having an external diameter of about 0.8 cm and internal diameter of about 0.65 cm. The tube is constructed at its lower end to about the 1 mm diameter with the hole in the side of the tube near the constructed part not less than 2 mm diameter. See, this need not to remember. You just remember it is having a wide mounted bottle of 120 ml. This is 120 ml bottle. Okay, then having a mouth of about 2 point, this mouth distance of this mouth is a 2.5 centimeter. This is enough. Then the bottle is fitted with a rubber bung through which glass tube passes. Means you know that this bottle is fitted with this rubber bung through which that glass tube is passed. This is enough. Okay. Then upper end of the glass tube has been fitted with the 2 rubber bungs, means this one, 2 rubber bungs. Upper end of the glass tube that is fitted with the 2 rubber bungs, each having a hole bore centrally 6.5. That is not necessary here. Just to remember, upper rubber bung means that is the upper end of the glass tube has been fitted with the 2 rubber bungs. Principle of this arsenic limit test is the chemical reaction involved in the method as follows. When the sample is dissolved in acid, okay, the arsenic present in the sample gets converted to the arsenic acid, and when gets reduced by reducing agent like potassium iodide, okay, stannous acid to arsenious acid. See, this first one is arsenic acid, arsenious acid. Okay, then the nascent hydrogen, this one is the nascent hydrogen formed during the reaction further reduces arsenious acid to arsine gas. Are you getting? Which reacts with mercury chloride paper to give the yellow stain. Okay, what is the indication of arsenic limit test? Yellow stain. See here, one point you have to remember, arsenic gas. I have told you, in arsenic gas, if you not use the cotton plug of lead acetate cotton, if you not use, means there is a chance of passage of the hydrogen sulfide gas with this arsenic gas. If you use, means the hydrogen gas get trapped. Yeah. Method of preparation, test and standard. See, 5 ml of test plus 1 gram of potassium iodide, then 5 ml of stannous chloride, 10 gram of zinc. This one. Then action is allowed for 40 minutes. We have to keep for 40 minutes. Yellow stain produce. Then prepared for standard solution, same. You have to add the standard solution here. Then you have to allow for the 40 minutes. Simple. Note a standard arsenic solution having 0.12 gram of parts per ml, 1 ml. This one need not necessary up to here. Note on chlorinated lime. So you know that chlorinated lime, it is an antimicrobial agent. The substances which are used to kill the microorganism are called antimicrobial agents. Chlorinated lime is also called as bleaching powder. Properties: it is dull white powder with odor of chloride. It is slightly soluble in water, less soluble in alcohol. On exposure, it absorbs moisture and forms chlorine gas. Storage: it should be stored in tightly closed container. Incompatibility: chlorinated lime, that is bleaching powder, it is incompatible with oxidizing agent, reducing agent. It acts as an uses disinfectant. Bleaching powder, bactericidal, used to disinfect wounds in wet dressing, as disinfectant in drinking water. That is chlorinated water, what you are calling, no? That is. Next one is a note on the saline cathartics. Saline cathartics, see, also called as the purgatives, are agents that quicken and increase the evacuation from the bowels. Okay, laxatives are the mild cathartics. Simple, saline cathartics, these are the purgatives which helps to prevent the constipation. Then cathartics are used to ease defecation in patients with the painful hemorrhoids or other rectal disorders, means that piles, to avoid excessive straining and concurrent increase in abnormal pressure in patient with hernia, inflammation in the anus, to avoid potentially hazardous rises in blood pressure during defecation in patients with the hypertension, cerebral, coronary and arterial diseases, to relieve acute constipation, to remove solid material from the intestinal tract before rheotinographic studies. Means if you want to study the disease or the diagnosis, we have to if you want to study the intestine, means what the doctors are doing, they are using this purgatives to remove the debris, waste products, and make that intestine clean, so we can easily get understand the intestine overview or the anatomy. Next one is example of official saline cathartic: sodium biphosphate, sodium phosphate. Okay, these all are, you can go through this one. Then sodium potassium tartrate, it is one of the purgative, that is saline cathartic. Physical properties: white crystalline powder, soluble in water, saline taste, insoluble in alcohol, efflorescence. Uses gastrointestinal agent, saline laxatives, antacid, then stabilizer in cheese. In effervescence powder, we are using this sodium potassium tartrate. Incompatibility: it is incompatible with acid, magnesium sulfide, calcium salt. Storage: it should be stored in well closed container, cool place. Note on dental products: simple, role of fluorides as anti-caries agent. See, it is a trace element occur in our body. Okay, fluorine, it is a trace element. It is obtained from the food and water. In some places where it lacks fluoride, drinking water can be fluorinated by the process called fluoridation. Simple, if fluorine is not present, means what we are doing means we are adding fluorine to the water. Okay, so that it can be changed to the fluorine water. Fluoride is administered into the body by oral or the topical route. Sodium fluoride tablets, 2.2 mg daily, 2% sodium fluoride solution that can be applied topically on teeth. This is the sodium fluoride, that is a dental product. We can use it as a dental product. And role of fluorides as anti-caries also we are using. Prevention of the tooth decay. It occurs naturally. It is mainly used to prevent the tooth decay. Then during tooth formation, fluoride is taken up into the enamel, which helps to reduce the tooth decay later. Simple, it helps to prevent the tooth decay. Remember this one. And it helps to maintain the bone structure. Very low dose of fluoride salts may be used to treat the condition that cause a faster bone loss than normal. Okay, see, you take any paste, Sensodyne paste you take, Sensoform. In that you observe sodium fluoride 2%. That sodium fluoride, this one. Just we are giving to prevent the caries, tooth decay. Sodium fluoride. See, physical properties: aqueous solution of the sodium fluoride corrodes glass container. Hence, it should be prepared in the distilled water and stored in the dark colored Pyrex bottle. Uses: it is means important agent in dental practice for retarding or preventing dental caries. It renders more resistant to enamel of the teeth against acid. 2% aqueous solution has a topical agent. Sodium fluoride paste contains 75% sodium fluoride, 25% glycerol, which is applied to teeth rubbed for 1 minute and removed by mouthwash. Okay, for the better action. Then write a note on antacids. See, antacids is a substance, generally a base or a basic salt, which neutralizes stomach acidity. They are used to relieve acid indigestion, upset stomach, sore stomach, and heartburn. Acidity problems. To prevent that all, we are using this antacid. Now, classification of the antacid: one is systemic, another one is non-systemic. Systemic is a sodium bicarbonate. Sodium bicarbonate, you take the example ENO. Yeah. Non-systemic, it is a non-absorbable. It cannot be absorbed. That is the aluminum containing antacid like aluminum hydroxide, calcium containing antacid like calcium carbonate, magnesium containing antacid like magnesium carbonate, combination antacid like magnesium hydrogen oxide or aluminum hydroxide, magnesium hydroxide is a combination. Now, our first antacid is that is aluminum compounds, that is aluminum hydroxide gel. See, it is aqueous white viscous suspension of the hydrated aluminum oxide having varying amount of basic aluminum carbonate. It contain not less than 3.5% and not more than 4.4% weight by weight of aluminum oxide. Preparation: adding a hot solution of potassium alum slowly with constant stirring. Potassium alum with a constant stirring. Then hot solution of sodium carbonate is formed. After that, by removing the carbon dioxide, that is a decarboxylation process, ppt of aluminum hydroxide is formed. That should be washed with the hot water to free the sulphate ion. Then we have to suspend it in required strength, that is we will get the particular hydrogen aluminum hydroxide gel. Then properties: white viscous suspension, a clear liquid gets separated when it is kept standing for some time, and it is astringent, it react with the gastric HCl. Nausea, vomiting on constipation. Okay, these are the some side effects. Say 5 gram of substances we have to take in a flask, add 3 ml of HCl, warm and cool, transfer to 100 ml flask. Volume: make 100 ml 20 ml of solution in conical flask, 40 ml of disodium EDTA plus 80 ml of water and few drops of methylate. In sodium hydroxide to neutralize acid, red to yellow. Then warmed for half an hour again. Then add 3 gram of hexamine plus 0.5 ml of xylol solution. Titrate with the lead nitrate. Okay, you will get the violet color. This is the assay. Uses: very effective, slow acting antacid. It is not absorbed in the alimentary canal, not produce carbon dioxide. Okay, widely used in the intestinal toxemia or hyperchlorohydria, excess secretion of the HCl. To treat this, we are using. Do not cause it gastric alkalosis. It's stored in a well-contained stone or it is in well-closed container, not allowed to freeze. Dose 7.5 to 15 ml, and it causes constipation and given with the magnesium salt, which is mild laxative. So for that reason we are using some of the magnesium salt like an antacid. Next one is a milk of magnesia. Is a suspension having less than 7% and not more than 8.5%. Very simple preparation: light magnesium oxide plus sodium hydroxide solution. Smooth cream is formed. Then that should be dilute with the water. Is produced thin stream into magnesium sulphide. We have to again stir continuously. Then allow the PPT to settle down. Okay. Then upper liquid removed by decantation and residue filter, upper layer. Then residue is washed with the water until become from sulphide free. Properties: it is white uniform suspension from the varying proportion of the water may separate out on standing. It is a white aqueous solution. Then assay, simple assay. You have to take the sample 5 ml. Then you have to add 25 ml of sulfuric acid. Then back titrate with the sodium hydroxide by using methyl red as an indicator. Okay. Then it is used as an antacid and laxative. Popular antacid. It has alkaline reaction. It is used in alkaline mouthwash. 5 to 10 ml as antacid we have to use. Okay, that is magnesium hydroxide, magnesium trisilicate. Both are same. Next, combination antacid. Sometimes this question may be asked for 4 marks. Write a note on combination antacid or write a note on magnesium hydroxide mixture. Or they will also ask write a preparation of a combination antacid. For all the questions same answer. Magnesium hydroxide antacid. It is a 8% oral suspension of the hydrated magnesium oxide. Ingredients: these all ingredients are present in that is magnesium sulphate, sodium hydroxide, light magnesium hydroxide, chloroform, purified water. How can you prepare this one? Simple: dissolve sodium hydroxide in 150 ml water plus light magnesium oxide. It forms smooth cream. Then pour this suspension in a stream into a solution of magnesium sulphate with stirring. Allow to precipitate. Wash PPT with purified water until the sulphite was washed. Means we have to make that sulphate free. Then mix the PPT with purified water. Dissolve chloroform and make the volume of the 1000 ml. Okay, this is the preparation of the combination antacid. Physical properties: white uniform suspension which does not separate easily on standing. Used as an antacid, oral suspension used to relieve in heartburn, also prescribed in case of stomach ulcers. And then uses of ammonium chloride. Ammonium chloride, it is an expectorant. Okay, NH4Cl. These are the agents that enhance the secretion of the sputum from the trachea, bronchi or lungs, and hence they are used in the treatment of cough. Means it will remove the sputum. Physical properties: white, fine crystalline powder, odorless and cooling saline taste, hygroscopic in nature, freely soluble in water but slightly soluble in alcohol. Storage: it should be stored in well closed container to use as an expectorant, diuretics and also a systemic acidifier. Our last question of this part 1 is write a note on inhalants. See, inhalants means inhalers, what we are taking now. Inhalers, these are the drugs used as an inhalants, may be inhaled or administered as a solid or nebulized particle from the solution or in the form of vapor. Sprayed as a fine droplets which deposit over the mucous membrane producing the local effect. Example is salbutamol. You will observe this type of the machines. Okay, simple. These all are the inhalants. In this the chemical is present. Just we have to press that one and that reaches to the lungs and it shows their action. First inhalant is oxygen. We can take oxygen. Molecular formula O2, weight 32 gram. Then our storage is oxygen is usually stored in metallic cylinder under compression and should be painted black. The shoulders of the cylinder should be painted white. Okay, the name of the gas or symbol O2 properly stenciled on it. The cylinders are recommended to be stored in a cool room free from the inflammable materials. Okay, because it get oxidized and has the power to receive the flame. So that for that reason it should be keep away from the flame. This is storage. Pharmaceutical use as an inhalant for supporting respiration during anesthesia or the post-operative conditions. Inhalant for poisoning due to other gases. Diluent for volatile and gaseous anesthetics. Then our next one is carbon dioxide. CO2 molecular formula, weight 44 gram. Then carbonic acid gas, it is also called as carbonic acid gas. Then carbonic anhydride. Property is a colorless, odorless gas, do not support combustion. It is heavier than air and it is soluble where in water. The solution is slightly acidic due to the formation of carbonic acid H2CO3. It can be liquefied under compression. If you compress that carbon dioxide, means it get liquid, can change to liquid state. It can be solidified, called as dry ice. In a solid state it is in dry ice, then it is extinguishes fire. Yes. Storage, it is stored in a metallic cylinder painted gray. Okay, the name of the gas or the formula CO2 should be stencilized or should be labeled on the shoulder of the cylinder. Pharmaceutical use essential for regulating acid base balance in the body, respiratory stimulant to give relief in hiccup what we are calling, no, that in that condition also carbon dioxide is used. Then soda water produces carbonative, promotes absorption for rapid excretion of inhalation anesthetics. Liquid orals treated with carbon dioxide gas are used to mask the taste. Yes, the part 2 to be continued next. So please subscribe our channel Let's Jam Pharmacy. Thank you.